good vision. We use it for work, for recreation, for carrying out our daily routine. And for years, many people relied on glasses or contact lenses to achieve that good vision. But more and more, people are now turning to the technology of lasers to improve their vision, and that has made LASIK one of the fastest growing surgical procedures in the world. Most of us have heard about LASIK. Maybe you even know someone who's had the procedure. But today, we're going to take a closer look at what's involved with LASIK. We'll talk to the experts to find out how LASIK works. Can it work for you? And what many people may not know about LASIK.
There are many components to a good result. You have to have good technology, a good laser. You have to have good judgment. You have to have good preoperative testing. You have to have good prices. You have to have a good facility. The critical thing is that your results and your happiness are the most important consideration. We want you to be satisfied with your surgery, and we'll do everything in our power to make you satisfied.
We'll also look at LASIK from a different point of view as we follow one patient's journey to better vision, from the preparation to the procedure and the outcome.
Dr. Shealy in the Eye Laser Center has been really nice. The people are wonderful. They're very friendly and very informative. They answered all my questions that I had. Dr. Shealy is just great. He really stepped me through it and made me feel at ease. It was just a really pleasurable experience.
If you wear glasses or contacts and you want to see better without them, you should take a closer look at LASIK. In the United States alone, the number of laser vision correction procedures has more than doubled in 1 year. And now that the procedure is approved for nearsightedness, astigmatism, and farsightedness, those numbers are expected to skyrocket.
It doesn't make any difference what you do, whether you're a fireman, policeman, doctor, a stay-at-home mom, a work-out-of-the-house mom, a stay-at-home dad, a work-out-of-the-house dad. No matter what your situation is in life, there are benefits and advantages to laser vision correction that far surpass wearing eyeglasses and contact lenses.
The fact of getting up and putting on glasses, well, in the wintertime, everybody knows what happens when you go outside with glasses on and come back inside different environments. And, you know, they'd fog up, couldn't see where I was going, things like that. You know, and trying to drive a vehicle is not a safe thing to do.
I had to pretty much wear my glasses all the time, which is a real pain, especially at work, you know, working on paperwork or whatever. I didn't need them to read, so I'd take them off to sit at my desk and then put them on to talk to somebody that walks up to ask me a question, or to look at the clock or our board that we have to keep our schedule on. And so they were off and on constantly.
Well, I've had glasses since I was about 6 years old. It was in first grade, and my eyes got worse very quickly. And by the time I was 7, actually, I got contacts. And I've had contacts all the way up till the laser surgery, which I was about 19, and just had a lot of trouble with the glasses and contacts.
I always wore glasses, just whenever go into family fights or bar fight situations. You worried about your safety and the safety of other people around you, but you subconsciously worried about losing your glasses or your glasses getting knocked off and broken.
First thing I did in the morning was put my contacts in. Last thing I did at night was take my contacts out.
Approximately 125 million Americans wear corrective lenses to deal with nearsightedness, farsightedness, and astigmatism. LASIK is the most versatile refractive procedure for treating these vision problems.
I first met Dr. Shealy 15 years ago as I was a patient of his, and I haven't worn glasses since that time. I was so enthused and so excited about having the procedure, so I started to work for Dr. Shealy. We're able to correct a broader range of prescriptions that most other centers or doctors can't correct, primarily because we have 2 lasers on site. One laser will correct nearsightedness or astigmatism, and another laser will correct farsightedness, different applications for different lasers.
Our center owns and maintains its own excimer lasers. We have both scanning and broad beam lasers. We were the first site in Indiana to have a scanning laser. We have several microkeratomes, since it's not a one-size-fits-all, and we can correct a wide range of farsightedness, nearsightedness, and astigmatism, which are not offered elsewhere.
Even though LASIK can treat a variety of vision problems, the basic steps of the procedure are the same. The first step of the procedure is to create a flap. The flap remains hinged and is then laid to the side. The second step is to apply the laser on the area beneath the flap. The laser pulses reshape the cornea in microscopic increments as determined by your prescription. The final step is to lay the hinge flap back into place. The natural pressure within the eye causes it to adhere almost immediately.
We bring our patients to the center and evaluate them and check the preoperative data. Then we bring them to our operating room. We do not use any needles or injections, but only place numbing drops in the eye. We talk you through the procedure, we relax you. The actual procedure takes about 5 to 10 minutes per eye. The laser application is in terms of 10 to 60 seconds, depending on your prescription. And pretty soon, the procedure is completed, and we take you out to our holding area and give you a few minutes before we check your vision in our post-operative rooms.
It didn't hurt, there was no pain involved, and then when the laser, it felt like somebody, if you would take your eye and actually hold your eye open and have somebody blow in it, that was about what it amounts to.
It took less time and was less painful than getting your teeth cleaned at the dentist's office.
The procedure itself was probably about 5–10 minutes each eye, very quick and painless.
My vision just was really frustrating. Prescription was about 2,800. I couldn't see, I couldn't see the big E on the chart. Couldn't even make that out. So if I wasn't wearing my contacts, I had to be wearing glasses. The procedure was so easy. No pain was involved. There was no shots. Numbing drops were applied. The whole procedure took about 15 minutes. With Dr. Shealy, I really felt a lot of confidence. It made me feel real relaxed about the whole surgery. It is something to be, a little concerned about and worried about, and the whole time, he never let me think anything but the best was going to happen.